Hi, everyone. Thanks for showing up, and we're waiting on a few more people to arrive, so we'll be starting shortly. Thanks. It's so great to see so many of you that I haven't seen in a while. This is going to be the first in our series, and our guest today is Eddie Salazar in real life. In Second Life, you would know him as Eddie Bergonis. And so today, Eddie will be speaking to us about clinical laboratory science, education, the profession, and its vital role in the healthcare team. In addition, the presentation is going to cover areas specific to the UTMB CLS program that prepares students for practicing laboratory medicine for the future. So again, let's give a big welcome to Eddie Bergonis.
First, we'd like to say thank you for inviting me to host the first round of the UTMB HomeTown Science 3D Talk. I'm very excited about being here, and I hope that I can give you some good information that will introduce you into the world of clinical laboratory sciences. First, I want to introduce myself. I'm a assistant professor here at University of Texas Medical Branch in the Department of Clinical Laboratory Sciences. I'm also a graduate of UTMB. And so my particular appointment is in clinical laboratory sciences, and one of my mission goals is to let the world know what clinical laboratory sciences is, both the folks in the healthcare team that may not be aware of its role, and also, of course, of the community. And so, again, thank you for being here and for learning about clinical laboratory sciences. Okay, first off, what I would like to start the talk with is to give you a couple of objectives, items that I would expect you as a participant in today's talk to be able to take with you after this experience. And first off, I would like for you to be able to discuss clinical laboratory sciences education, be able to explain clinical laboratory sciences as a profession, what it does, identify clinical laboratory sciences' role as part of a vital component of the healthcare team, and describe what we do here at UTMB in regards to clinical laboratory science education. Okay? So that's our goal, where we want to direct our talk today, and hopefully we will cover all those points by the end of today's talk. So the first thing you may be thinking is either I've not heard what a clinical laboratory scientist is. I had no idea what that profession or that the profession existed. And that may be because it's also known with other names. It used to formerly officially be called medical technology, and currently, about 3-4 years ago, it was officially changed to medical laboratory sciences. And you're probably scratching your head thinking, well, I'm talking about clinical laboratory sciences today. Well, all those three titles are the same. But it shows the progression and the growth of the profession in regards to have an identity as part of the healthcare team. And so today I'll walk you through those pieces and why those changes have occurred. But just a tidbit, clinical laboratory scientists serve as the healthcare detectives. They work behind the scenes, which is a common issue in which folks typically do not interact with a clinical laboratory scientist. And what they do with their work provides information to clinicians, whether they're physicians, nurse practitioners, physician assistant nurses, etc., that aid in the diagnosis and treatment of disease. Items that clinical laboratory scientists use range from any biomedical instrumentation, analytical techniques. Technology plays a large role in the generation of this data. And with these particular techniques, instruments, or items help to, again, either prevent disease, detect disease, and also monitor the treatment. So that's a tidbit of the profession. And before I continue, I want to give you a brief history of how this profession got started. Okay. So when we talk about medicine, when we talk about healthcare, Obviously, it's been around for a very long time, and the laboratory has had its presence from the very beginning. And one of the items that we first talk about in regards to the development or the presence of lab testing goes all the way back to, say, 300 BC, back in the ages of the Greek physicians, Hippocrates, and so forth. And basically, it involved working with body fluids. And I like to tell my students a story about urinalysis, in which they used to actually take patient samples of urine and place them near piles of ants, and to look for patterns of these ants migrating towards the body fluid, indicating that there may be some presence of glucose because of the sweetened odor and taste of the particular sample. So it's been around for a while, and it's also helped push things such as licensure and formation of medical groups, because some of these tests were relatively easy to perform. There was a huge need for standardization, which then led to items that required folks to standardize these types of tests. The first recorded clinical laboratory occurred in the late 1800s, and actually 1896, and occurred in Johns Hopkins University. That's the first one that's on the records. But at that time, clinical laboratories were still considered not necessarily a highlight or point of the healthcare team. And it wasn't until we had some changes that occurred in our medical history, things such as being able discovery of the causative agents of devastating diseases such as tuberculosis, diphtheria, cholera, all these occurring in the late 1800s. And then with the development of lab tests to be able to detect these diseases and monitor the progression and treatments, that's what really caused the clinical laboratory to come up to the forefront of the medical healthcare team. And so you started to see in the early 1900s in which physicians specifically were training individuals in the hospital to be able to perform these tests. Okay. So this, again, early 1900s. About the 1920s, 1928, the American Society of Clinical Pathology created what's referred to as the BOR, which is the Board of Registry. And this was in order to certify that clinical laboratory scientists were standardized, that these individuals had a particular curriculum that they were following, and that the individuals that were carrying out these laboratory tests had the knowledge and the education to be able to perform this test in a manner that would help the clinicians use them for either diagnosis or treatment or therapy of patients. And so it's been very, heavily written that the American Society of Clinical Pathology played a pivotal role in the development of the clinical laboratory field of profession by, again, being able to come up with the standards and competencies and regulations for the profession. As the need for more laboratory testing increased, as we had more tests become available, also the profession gained its own autonomy, and therefore the American Society for Clinical Laboratory Sciences was formed, and that then was able to migrate to an independent standing national accrediting agency referred to as NACLS, and that stands for the National Accrediting Agency for Clinical Laboratory Sciences. And at this point, that is, to this day, it manages the accreditation for all university-based clinical laboratory sciences programs. Okay. So going on with the profession, a little bit of the track. So I want you to pause and think for a little bit if you've heard the term medical technician, medical technologist, laboratory scientist. Have you ever gone into a clinic or a hospital, an emergency room, and you've had your blood drawn? Have you ever wondered what happens to that blood? Where does it go? What do they do with it? Eventually, the physician, nurse practitioner, PA, come back and give you some kind of news or some kind of diagnosis or treatment plan. Well, there's a step in there in which involves the clinical laboratory scientist. That's where that sample goes. That's where the data is generated, interpreted, and then passed on to the clinician. So indirectly, in some form or fashion, if you've been part of the healthcare team or sought healthcare, you have been indirectly involved with a clinical laboratory scientist. And so I mentioned two particular names, medical laboratory technician and medical technologist. There are two items that are related, but there are two levels of a clinical laboratory scientist. The first one, the MLT, or medical laboratory technician, are competent individuals that are competent in either the collection, processing, and the analysis of some of the biological specimens and some of the lab procedures. That is typically an associate's level degree. The medical laboratory scientists or clinical laboratory scientists are also known as medical technologists, have a more extensive theoretical knowledge base. These are the folks that go on and earn a Bachelor of Science degree in clinical laboratory scientists. And they're able to perform more sophisticated lab procedures, are involved in the evaluation and interpretation of results, integrating data, problem solving, consulting, and being part of the healthcare team. And so that's what we're focusing on today, is the medical laboratory scientist or the clinical laboratory scientist, which you'll find here at UTMB. So now you may be wondering, so what education, what route is required to become a clinical laboratory scientist? What are the requirements? In this case, we have a specific curriculum that addresses all the theoretical and practical aspects of all the sciences. And so it comes down to being able to meld the mathematics and the science together in the realm of a clinical environment. And so typically these clinical laboratory scientists will complete a baccalaureate degree program that involves all these courses. In addition to those science courses, the clinical laboratory sciences bachelor's program also involves classes that involve management and education courses. A lot of these clinical lab sciences go on to either become supervisors, lab directors, or also part of healthcare administration in regards to the clinical laboratory. The outlook for employment with clinical laboratory scientists is on the rise. According to the Bureau of Labor Statistics for the U.S. And the DOL, or Department of Labor, there's an estimated increase of 14% of clinical laboratory sciences need within the next couple of years. And there are a couple of aspects that are contributing to this demand or increased demand. And one of those is the retirement of the current CLS workforce. We have a lot of folks that went into the profession 2 or 3 decades ago that are ready to retire. And so there's been a decrease in folks going into the profession, and we're going to have a huge increase in folks leaving the profession. And so that's going to leave a large void. You also have changes in laboratory testing due to the demands of healthcare. You have a lot of technology that has come into play within the last 10 to 15 years. There are a lot of new molecular techniques that require expertise in carrying out these laboratory testing. And as we move into an emphasis of increased quality of healthcare and a patient-centered approach, it is critical to fill those needs to ensure that the lab test that is being reported out is accurate and precise. And that's going to require, again, an increase in the workforce of a clinical laboratory scientist. Okay. So I've given you a little bit of history of clinical laboratory sciences, giving you the piece of the different names or different titles you may have heard of this profession. and also kind of giving you a glimpse of how you have indirectly been involved with clinical laboratory sciences. And now what I want to do is walk you through some of the divisions of the clinical laboratory sciences and give you a little bit of a fusion of how these particular areas work for the patient, how they work for the healthcare team. How does it all come together? There are distinct divisions. You have a hematology division of a laboratory, coagulation, clinical chemistry, clinical microbiology, immunohematology, and molecular diagnostics. These are the main or the core of a clinical laboratory. And so when you look at a hospital, when you think about clinics, and you may think about a laboratory, and you may think of it as a one large room where everything takes place. And perhaps it may be that physically, but it's divided into these particular divisions. These divisions carry out independent testing that all comes back together to give that patient care, treatment, diagnosis, etc. Now, of importance, there are other support services that aid the laboratory in being able to carry out its mission. And some of these services you may have run across. I want you to think about the phlebotomist. The phlebotomist is the profession or the individuals that you may have directly dealt with, in which they collect your blood specimen. For example, you've gone to the ER or clinic or gone in to get a physical, and they required some blood to be drawn. The person that drew your blood was referred to as a phlebotomist, and the phlebotomist is typically associated as, be in the laboratory. But the phlebotomy department, or the phlebotomist, is an arm or an extension of the clinical laboratory. That's a collection piece where the samples are collected and then transported to the clinical laboratory. Other areas are going to be your central processing. What happens to these samples? How do we make sure that they arrive to the lab? For example, if you're in the outskirts of Houston in one of the clinics, and that sample needs to go downtown or to the medical center to be processed and run, there has to be a central processing area and then a complete division that allows for ensuring that the transport and the handling of that specimen is appropriate. Another area that is up and coming is also referred to as LIS, Laboratory Information Services or Systems. And this particular area is playing a huge role in the role of technology in being able to allow instruments to talk to each other and allowing the instruments of the laboratory to talk to the electronic medical records, to talk also to the order entry in which physicians or nurses or so forth enter particular orders to the laboratory system. So how does this all come together? What is the impact of this profession? What does this profession provide to the community? What does it provide to you as either as a past patient or to your family members or so forth? And the impact is that the clinical laboratory science profession plays a crucial role in the diagnosis and treatment of any disease and or the route of preventative medicine. For example, you're going for your physical, you want to know what your numbers are. You want to know where that cholesterol number came from. You want to know what your sugar level, your glucose level is. If you've had somebody come in with chest pains, you want to know, are they having a heart attack or not? Have they had some kind of myocardial damage? With these particular information, your clinician is able to tell what has occurred and what treatment plan should be sought. In addition, technology is moving at a very fast pace within these last couple of decades. And so you need somebody that is very proficient in the techniques and also the different types of methodologies that are available. You need to ensure that there's a quality assurance for the process, to make sure that these instruments are working correctly, being able to detect when you have errors, and ensure that when the results are delivered that they're accurate and precise. Another impact for clinical lab sciences is the management positions that are available. And these involve creating these budgets. making sure that the lab is fulfilling its need, whether it's short-term planning, long-term planning. What are the future needs, for example, in the next flu season? What kind of testing is going to need to be performed? What kind of long-term plans should be stabilized? And then there's the role of the teaching or the academia, in which we have CLS or clinical sciences like myself that hold faculty positions in NACO-approved programs to ensure that we're getting the workforce of the future ready to be a vital team player in the healthcare team. Now, I've typically am asked, well, can you give me some specific items in which clinical lab sciences or the profession is involved as part of the healthcare team? And so I mentioned the different divisions: hematology, clinical chemistry, microbiology, blood banking, and so forth. And some of these tests you may have heard of. If you're within the healthcare environment, some of these may be familiar to you. If not, you may have some of these run on you when you've been involved with your healthcare. Things such as a complete blood count. Have you ever had a viral infection or bacterial infection? How can we tell if it's one or the other? You've heard of individuals that have anemias. How can we tell if they had an anemia and if they are corresponding to the treatment that the clinician is providing? Also, you've had folks that need blood or or folks that have donated blood. You have the need to make sure that that blood is compatible to its particular recipient. So you have your transfusion medicine, your cross matches. Anytime when you have issues with bleeding, if you have somebody that is taking particularly a prolonged amount of time in order to stop bleeding, the area of coagulation, liver enzymes, cardiac markers, your cholesterol levels all fall into the clinical chemistry laboratory. Under microbiology, any type of blood culture, if you have a wound that's been infected, clinical laboratory sciences grow these particular cultures and are able to tell what organism is causing the issue, and also particularly what antibiotics would help reduce or eliminate the bacterial infection. Transplants. In the cases of making sure that the organ is not going to be rejected by the recipient, making sure that it's a match, making sure that the organ is functioning well is all part of the immunology or the clinical laboratory sciences lab. Autoimmune diseases, being able to detect these and again monitor the progress or therapeutic process. So all of these areas show how the clinical laboratory is involved. In some form or fashion, indirectly, the clinical laboratory is being part of the healthcare team. Unfortunately, it's behind the closed walls, and so you may never interact directly with the clinical laboratory sciences. As part of the community, as part of a patient, as part of the healthcare team as a clinician, you may become involved with the clinical laboratory sciences, and typically it's in areas which are gray areas in which a particular lab test is not directly giving you the information you need, or you're not sure which direction to head towards. Or sometimes you have laboratory tests that, for example, I'll go in with vitamin D. If you're looking for vitamin D deficiency, if you're looking what particular test to access for that, if you pull up the menu, there's going to be about 25 different tests that have vitamin D in them. And you would think that it would be labeled vitamin D deficiency. No, it's something like 25 hydroxy that you'll have to order. So things like that help the patient-centered approach is going to be a crucial relationship between the clinicians and the clinical laboratory scientists. I want to get into an area of clinical laboratory sciences that directly impacts all. It impacts the healthcare team, it impacts the patient, it impacts the laboratory, and that's the area of quality assessment. Quality assessment is a systematic lab program that has 3 different phases of testing. And these 3 different phases of testing are meticulously watched or cared for by a clinical laboratory scientist. And these all apply to either the specimens that we receive, the methodologies that we use to analyze these specimens, the instruments or instrumentation we use, and even our personnel. These 3 areas are referred to as pre-analytical, analytical, and post-analytical. Pre-analytical is an area that occurs before any analysis occurs. And so anything from labeling a specimen correctly, transporting it in the appropriate temperature, in the appropriate vial, in the appropriate environment is all crucial. The processing of the specimen. Does the specimen need to arrive on ice and remain on ice throughout its processing? Does it need to be separated or spun immediately upon receipt? Does it only have a lifespan of an hour or 2 hours? All these items are pre-analytical. And these areas are some of these are very easily recognized, and some of these are overseen very easily. And the issue comes to light when it actually affects the specimen. So a specimen is only as good as its integrity. The other area is the analytical piece. The analytical piece or phase occurs during the testing process, and this includes any problems related to reagents, instruments, quality controls, calibrations, and even the performance of personnel. So anything that can go wrong during analysis falls under analytical. So for example, you use the wrong volume of reagent, you use the wrong reagent, you use the wrong methodology to measure and analyte, or the calibration is not off, or the calibration has not been performed correctly, all the way to the knowledge base of the personnel. This is where the critical component comes in our certified licensed clinical laboratory scientists. Do they possess the appropriate knowledge in order to be able to run these tests? The third phase is referred to as the post-analytical phase. And as you would imagine, that occurs post or after analysis. This is any area or any item that occurs after the analysis has passed. Anything from clerical errors, the reporting of results, test interpretation, etc. So, for example, transcription is a very common error, and we try to minimize as much as possible any type of transcription. For example, if I give you a potassium value of 7.0 or 6.0, if you make a mistake in transcribing that particular value, it is life-determining. You should be able to know if you get a potassium of 7.0 that would not be compatible with life versus a 6.0 critical value. Also, you have issues of reporting results verbally. If you call the floor and it is not reported correctly and they act on that value, that is a post-analytical issue. Interpretation. Not being able to interpret the value correctly. Is it beyond the linearity of the instrument? Was it collected in the wrong tube and the values are therefore completely erroneous? Is there a difference between the past value that we received? Can you interpret those, catch those types of errors? So all of this piece, of the quality assessment piece, is all carried out by the clinical laboratory scientists. All of this takes place behind the scenes to ensure that all the values that are reported from the clinical laboratory are accurate and precise. And so this all involves a written laboratory procedure manual for every single test that is performed. If you stop and think about how many lab tests are found in the clinical laboratory, you can think about over 1,000. In one particular area, there could be as many as 200. And so for every single one of these procedures, we need to make sure that we have the best practice, the appropriate methodology, the appropriate reference ranges, whether they're for adults or pediatric. Some of these may also change based on the location of the clinical laboratory. Also following national guidelines, for example, glucose or cholesterol. All of this is contained within the laboratory procedure manual. The other area is spelling out specifics for specimen collection and identification. Every single hospital has a standard operating procedure on the appropriate specimen collection or identification techniques and what occurs if an error is revealed, what steps are necessary to ensure that the results are accurate and precise for the patient. Methodologies. Identifying what method is the best for the patient or best in regards to the case scenario that the clinicians are dealing with. For example, is it appropriate to use a point of care instrument versus the reference methodology? What specificity or sensitivity is appropriate in order to have these results for a patient? What is the need or the particular cause for ordering a laboratory test? And that brings us to our reference ranges. Are we following national guidelines? Are we following a local reference range? Where are these reference ranges coming from? The preventive maintenance and record keeping. You've often heard, if it's not documented, what? It never occurred. You must be able to track back and be able to identify what steps were taken in the case of lab testing and also the patient treatment. Some of the areas of the laboratory mandate the record keeping is indefinite. For example, the blood bank, they do not destroy or disregard records for indefinitely. Some areas may have 10 or 15 years or so, but it's a crucial component of the quality assessment program to ensuring that, again, these values are accurate and precise. So throughout the last 20 minutes or so, you've probably heard me say a couple of terms over and over. Things such as precision and accuracy. These are two terms that we hold very dearly in regards to the profession of clinical laboratory sciences. And there are two terms that are related, but yet different. And these are these two terms that we abide to when we report these results. The first one is precision. Precision is being able to reproduce a result. This is realized when you have a repeated lab test value and it yields the same value. Accuracy is how close, or the closeness of the measured result to the true value. When we report laboratory results, we want high precision and high accuracy. So every time we repeat that lab test, we want to be able to get to the same value or close to the same value, and we want to be as accurate or as close as possible to the true value. And that's what the clinical laboratory sciences profession is based and founded on, is being able to provide accurate and precise results to clinicians. This gives us reliability. That's the ability to maintain both precision and accuracy over an extended period of time. That's the challenge that we have in the clinical laboratory. Now, I've talked a little bit about the profession. I've given you a little bit of history. I've given you a little bit of application of how the clinical laboratory sciences profession is part of the healthcare team. And now I want to talk about the University of Texas Medical Branch specifically. What do we do here at UTMB in order to turn out the best laboratory professionals for the field of medicine? And so we have specific goals in our program in which we enhance the experience or provide the experience for our students to be able to collaborate with other institutions and being able to provide them areas for networking, whether it's at the state level or national level. Highly involved with our Texas Association of Clinical Laboratory Sciences, involved in areas of research in which clinical laboratory sciences is able to provide a need or a service. Being able to provide competent clinical laboratory sciences for the areas of Texas and beyond. And we focus that by having a generalist education. All of our graduates will have experience in the major areas or the core of the clinical laboratory sciences. So hematology, microbiology, blood banking, urinalysis, clinical chemistry. In addition to specialized instruction, we have folks that come in with associate's level and then specialize in particular areas. We also have graduate program that allows our students to focus their studies. These particular graduate opportunities allow the profession to be able to go to the next level, whether it is a technical specialist or at a higher management level position, in order to be able to interact with the rest of the healthcare administration. The opportunity of the faculty that we have in order to mentor our students is also of paramount importance. Being able to have that relationship with a student in which we can identify their goals and being able to pair them with the faculty that have similar goals and similar background or experiences to be able to help them get to their point of interest or meet their goals. Promoting the team concept in healthcare. This is an area that is extremely large, an area that has been identified as lacking in the area of healthcare, and something that UTMB is very proudly working on and enhancing, and that is getting that interprofessional healthcare education mindset of our students. Early in their formal years where they're learning, to get them in that sense where they work together as a healthcare team as opposed to individual silos. Have medical students understand what clinical laboratory sciences does. Have nursing students understand what medical students do. Have occupational therapists understand what a physical therapist does. This is all a critical mission of the University of Texas Medical Branch, and something that the UTMB CLS curriculum holds very dearly. And so at every opportunity we're able to pair our students up with different experiences that take them outside of the clinical laboratory sciences realm, so that they understand and appreciate what other areas of healthcare do for the patient. In addition, the other areas learn what CLS is about. Disconnected there for a bit. Finishing up with the UTMB CLS curriculum, again, we are in a mindset of interprofessional healthcare education here at UTMB. And I believe that's one of the strong points that we have to contribute to the practitioners of the future. And UTMB CLS is a definite component in participating in such an event. And by this, I mean that clinical laboratory sciences students are able to understand what the other professions, and not only understand, but appreciate and respect what other areas contribute to the patient, as well as other areas, understanding what clinical laboratory sciences brings to the table. So a particular area of the UTMB CLS curriculum that is of paramount importance. I'm going to talk a little bit about the degree options that we have here at UTMB. And we have, first off, the Bachelor of Science in Clinical Lab Sciences track. That's often referred to as a regular track. And that is a bachelor's level, again, in which students come in and complete their junior and senior year of a 4-year degree plan here at UTMB, and then are eligible to sit for the Board of Registry exam. Then we also have an articulation agreement for our individuals that are medical lab technicians, again, folks that hold an associate's level degree, for them to come in and take upper level courses in order to earn their Bachelor of Science in Clinical Lab Sciences. So those are two very important, very popular tracks. In addition to our graduate programs, we offer 2 graduate programs here at UTMB for Clinical Lab Sciences. And that is, the first one is where we have folks that have earned a Bachelor of Science in Clinical Laboratory Sciences to go on to earn a Master of Science in Clinical Lab Sciences. And these individuals go on to hold upper level management positions, upper technical areas as well. And then we have folks that have earned a biology Bachelor of Science that come in and then work on their Master of Science in Clinical Laboratory Sciences. In addition to that, we also offer areas for categorical specializations, folks that want to specialize in one particular area of the laboratory. And those areas would include specialists in hematology, clinical chemistry, microbiology, or transfusion medicine. And so how do we accomplish this? What do we have in our laboratories? We have a specific lab setup that promote teamwork, the way that our areas are state of the art, and they promote a hands-on approach. So while we do have some simulation and we reap the benefits of virtual simulation, the hands-on approach is also a very crucial or critical component of our instruction. We teach students to learn or understand what is inside the black box. Is it a fluorometer? What kind of spectrophotometry are we using? Are we using fluorescence? Are we using wavelengths, etc.? And in addition to that, we use technology to our advantage, and so we're able to do synchronous education as well as asynchronous education. A little bit of my background is also in educational technology, hence my involvement with Second Life in 3D virtual environments. And so we really like to integrate. We really like to integrate technology into our curriculum. Items that we use in our educational curriculum involve the use of Second Life, and we've gone on to build a virtual clinical laboratory in our UTMB Alpha Island. And this particular area allows us to have our students visit a virtual environment without having to step outside and go out into use limited resources. And a particular activity that I've come up with is one of the very first items that our students are introduced to, and that's laboratory safety. And so with this particular area, we allow them to navigate a virtual lab and find what these lab safety issues are and be able to experience them. And so this particular area just goes on to help with getting students into that virtual 3D mindset. Okay, at this time, we have a little bit of time for questions. I hope that this has been informative for you and that it has piqued your interest. And so at this time, please give me some questions to answer for you.
Thanks so much, Eddie. And Teresa Ann is getting me the questions. Okay, it was said he wanted both high precision and high accuracy. What's high accuracy? What's the trade-off? What do we get less of, or does it just take longer?
With high accuracy, you're trying to get as close as possible to the true value. With precision, you want to be able to reproduce that consistently over and over. And so what happens is, if you're not as close to the true value, for example, I want you to think of it as a target or a bullseye. Accuracy is being able to hit that bullseye. But without precision, you may hit the bullseye once, and then you're going to, with low precision, you're going to hit all around the bullseye. And so with our lab test, we want to be able to hit the bullseye or get as close as possible to hitting the bullseye time and time over and over.
Is there a cost differential involved in having both accuracy and precision?
Yes. The involvement in being able to have both the high ones depends on a role of sensitivity and specificity. So sometimes you can have where your method is specific for an analyte that you're looking for, but it may not pick it up as it may not be as sensitive as it needs to be. And that's where the role comes of deciding which lab test is best suited for the particular instance the clinician is looking for.
Thanks so much. Another question we have is, how well do you think that learning occurs in traditional classrooms versus virtual classrooms versus more traditional online education? And why they want to know why.
Okay, great. That's a great question. I think in some of the literature that we've looked at, that the learning both versus traditional versus virtual is pretty close, and we have information based on our pass rates for our boards that are very regarding the virtual that mimic our traditional classroom. And I think that has to do with the mindset of the particular students that we're getting now. We get students that come in that learn better virtually on their own pace, and that are keen to picking up on the concepts that occur virtually, versus the traditional classroom where some students can get easily bored in the classroom, or if they are not if they are not able to facilitate the traditional classroom or ask questions at that point in time, the benefit of the traditional classroom is not there. Now, I will say that in order for a virtual environment to work, it does require the instructor to be able to be on the same level as the students. And what I mean by that is being able to navigate the virtual environment, being able to interact with the student. That, I believe, is what makes the virtual environment successful.
Great, thank you. Now, I think the next question I'm gonna answer. Marjorie Chardon wants to know, she was wondering about providing feedback on a few things not covered by the survey. And, Marjorie, back in the back corner, you'll see Bella, ELLEBELLAH. Please address your concerns or comments to her. You can also address them to me, and I'll get them to her, or even Teresa Ann. Okay? Thank you. We have another question. We actually have a comment that I'm going to share from Gentle Heron. Pursuing the analogy of shooting at the bullseye with great accuracy and precision, you'll need a more expensive rifle, and you need to take more time shooting. So that goes back to what you were saying about precision and accuracy. So yes, it affects time and cost, basically. What a great analogy. Havanuther Latte, am I pronouncing your name right? Can we visit the virtual classroom, and can you escort us over to the lab?
Yeah, yes, we can definitely do that. I believe we're going to answer some of the questions before we do that, but definitely I would like to take you over to our virtual lab before we leave today. Absolutely.
Woohoo, field trip. Very good. All right. Question 5 from Gentle Heron. Would like a citation to that efficacy research on the different learning environments. So, actually that's a great point. Okay. And maybe what we can do is, have any if there's relevant citations you want to, share, we could probably make some kind of Dropbox here to share them in.
Absolutely. I can give those to Ellen Adrians to forward to the group.
Yeah, I think that'd be really a good thing to have. Let's see. I think that's all our questions for now. Also,
we had one other one.
I do. I missed one.
In chat, are any of the materials related to clinical sciences available from sources such as Coursera? That was from Marjorie in chat earlier.
Oh, okay. Got it.
I can chime in here because Coursera is MOOCs, and that's something I've been asking Alan about if the University of Texas, as a whole is doing any MOOCs as well. It's a very, very hot question right now.
Yeah, I'm not that I'm aware of. We would definitely like to be a part of that. I know for sure, and I know it's been talked about, but I'm not sure where University of Texas stands with a MOOCs with clinical laboratory sciences at this point. But we'd love to be involved.
Well, thank you. All right, we've got one more question.
That's from Gentle
Wondering
Haran.
if I'm sorry.
Okay. That's from Gentle Haran again. Sorry.
Okay, Gentle Heron. Okay. Wondering if, Eddie, if you have published information for other instructors on how to create successful virtual classrooms.
I don't have information published on that. What I have published has been on using online technology, the different areas of technology, but that is something that I'm definitely interested in what it takes to be successful using virtual learning environments, because I think they give us a whole other set of tools and an untapped resource that we can definitely use to reach students in all areas, especially medicine, but all areas.
All right, very good. Are there any other questions? And I want to chime in real quick and say, you know what? There is definitely a need for teacher training and any kind of teacher training that helps us design better virtual world classrooms. So look forward to that. We have another comment. Ella Bella has a great website and discussed some aspects to this last question. So, Ellen, you might want to make sure you share that, cause that sounds like something really valuable. Oh, y'all can hardly hear me. Sorry about that. Hopefully this is a little better. And, I think we're finished if Eddie, if you're going to run and take everybody over to the lab.
Okay, sure.
I want to thank everyone for being here. We're going to do this again next month, and check the website for our next talks, and we'll look forward to seeing you again. Thanks.
Great. Thank you very much.